Why is intersectionality so important for understanding the problem? First, tell us what the problem is with Black women and PrEP. What's the issue?
In my view, it's a multi-level, multi-dimensional problem. I think there isn't a single, here's, if we can do this, we can do that. But I think without intersectionality, we will never achieve health equity when it comes to accessing PrEP, because we will miss completely important, relevant mountains that people have to climb to use it, to get it, to use it, to know about it, to hear about advances. So like we as
Tell
scientists,
people just what I'm assuming that everybody in the salon knows what PrEP is, but just in case, just give us an overall what is PrEP?
PrEP is pre-exposure prophylaxis for HIV, and it's a drug that you can take that if you're taking it correctly as it's prescribed, the chances that you are going to acquire HIV are just negligible for all intents and not for the minutia of people for whom that doesn't work, but most people do not acquire HIV. You take it like you're supposed to take it, you're protected. But it is complicated. It's a biomedical intervention. For a lot of people, it's a daily pill. It's still a daily pill. There are different modes of delivering that medicine. So you could take, for some people, that it's a daily pill. For some people, it's an injection every couple months. And that science is changing pretty rapidly. So there are different intervals with which you could have the injection. It's long acting. But what complicates things is that different communities are eligible for different modalities. So like women, oh, wait, there's multiple versions of PrEP. There's post-exposure prophylaxis, which if you think you've been exposed, you take this combination of medicine and it.
So like a plan B, like with
Yeah,
contraceptive. Yeah.
exactly. Morning after. There's pre-exposure prophylaxis. So different groups of people are eligible for different modalities of delivery, and that is also changing pretty rapidly. And the reasons for that aren't necessarily tied to the effectiveness of the medicine. Sometimes it's tied to the effectiveness of the medicine. Sometimes it's tied to the fact that we just don't know because those people were not included in clinical trials, right? So like, okay, so part of the trouble, as you can see, with explaining, with delivering PrEP in an equitable way, is that it's complicated. And the rollout of it was a total disaster. I mean, as far as women are concerned. So a lot of women don't think that it's even relevant to them, even if they're eligible, even if they could benefit from it, even if they think it's a good idea. They don't know, a lot of women don't know it exists. Let me start by saying that. If you dropped a PrEP pill in the middle of a party, it might get stepped on because nobody knows what it is. Other communities, you drop a PrEP pill in the middle of the party, everybody knows what it is. It's just not as widely known among Black women.
Mm-hmm.
There are lots of Black women who know about it, but don't know that they're eligible or don't know that it's available to them. Providers aren't really telling us about it, and many are resistant when we ask for it. We as scientists assume that PrEP is like the end of HIV because it is the first woman-controlled, autonomously controlled prevention tool. It's discreet. You don't have to tell anybody, but that ignores a whole social context in which women are not going to take a pill that could prevent HIV because they run or have the possibility of acquiring it and not tell their partner that he should protect himself. Because if I'm going to get HIV, where am I going to get it from? So if I'm at risk and I'm protecting myself, what kind of partner leaves you out in the cold like that? I'm going to tell him. And I'm going to tell him I'm taking it and that he should take it. And a lot of women, those are the kinds of norms and obligations that we're working with.
Mm-hmm.
Then there's the fear that if I don't, what if he finds out and I didn't tell him and now he's found out? So there's a whole bunch of social stuff for women of color in particular that just don't apply to other communities where PrEP is much more normative and widely known. But then there's all kinds of different stigmas that intertwine with one another. So, and then there's structural stuff, right? Like the providers who don't know about it, the providers who don't think women are eligible for it or aren't interested in getting women on PrEP or don't tell Black women that they should know about PrEP because they don't think that we will take it as it is prescribed. So there's all these complex barriers specifically that Black women face. And that's why intersectionality is important, because without that intersectional lens, if you look at the numbers, I tried to develop a slide to show how many Black women are eligible for PrEP relative to how many are using it. Those data, I cannot get those data. I can tell you how many men versus women are using
That's right.
cis
That's right.
men. I can tell you how many heterosexual men, how many men who have sex with men, how many women, how many trans men, how many but I cannot tell you how many. All I can say is that relative to cis men, cis Black women are here, and relative to this other major group, uh, relative to white people, Black people are here. So if you put those two stats together, you can make some assumptions.
Right.
And
It's still very much single access data. Yeah, I've seen some of that data, and it just there's nothing that you can infer in terms about like distinct intersections like Black women.
so this is, I think it's crucial. I think intersectionality is crucial if we're going to even stand a chance of ending the epidemic. And I think certainly we won't bring about health equity without it.